Hi, everyone, and welcome to another edition of the Holistic Health Hub. I'm here with my amazing colleagues. I'll start with myself just really quickly. My name is Maggie Chilton. I'm a registered holistic nutritionist. And Sally, why don't you introduce yourself?
I'm Sally, and I'm a holistically fit specialist.
I'm Harry. I'm the learning difficulty expert from Down Under.
And I'm Shauna. I'm a naturopathic doctor hiding in the ruins today.
Love the backdrop. It's beautiful.
Yeah.
So Shauna, do you want to tell us a little bit about our topic today?
Yeah, so today we're going to talk about getting the most out of your healthcare, including resources for fitness and education, all of that. And most importantly, how to be an advocate for yourself and the importance of that in your medical care and beyond.
Yes, Shauna and I were talking about this today and how really important it is that you keep records of everything that the testing and the conversations, particularly that your doctor and you have, because there will come a time when you go and see, a new physician or perhaps a naturopath who used to seeing an MD or a nutritionist, and they will or should ask you a lot of questions about previous health, family health, what testing you have done, what maybe they want to see your testing. And if you can't produce those, it can make your health journey quite difficult to sort of navigate if you don't have that piece of the puzzle sometimes.
That sounds good, but I think there's something that comes before that, and that is the need to take self-responsibility. So you're not just walking in as a patient, but you actually transform yourself into a client. And make sure you know what it is you're taking and why.
Yeah, and that comes with experience, right? When Sean and I were talking today, I was saying that it took me until 2 years ago to actually know what I wanted, know why I needed it, therefore was able to go in and ask for what I needed. But that shift in mindset to, I'm not just going to sit there and be passive and you tell me what's wrong, to I want to investigate X, Y, and Z. That's a huge mind shift for a lot of people.
It is until you're exposed to it.
Mm-hmm.
It's from, day zero when you're actually told, well, you can make the choice. Yeah.
Yeah.
Mm-hmm.
So I work in an osteopathic clinic, mostly osteopathic clinic, and then we got a little wellness clinic on the side, and the osteopaths almost exclusively have patients. They go in and want to be fixed. Whereas on this side we have clients. It's kind of a headset.
Mm.
Yeah, it is very different. It's a different mindset for the practitioner and a different mindset for the client or patient too. Yeah, I agree.
Now, that's something I talk a lot about when people first come in to see me, is that I like to frame it differently. So I frame it for them so that they're looking at me as a consultant rather than authority on their health. I encourage them to do their research, to ask their questions, to come prepared, and to use me again as a resource who knows the health world body's best. So perhaps the wording, perhaps I should switch my wording from patients to clients to make that more clear. That's an interesting insight.
Yeah.
Well, as holistic nutritionists, we can only call them clients because we're not diagnosing anything. That is not within our scope of practice. So we are just helping them on their health journey. So I think that's a good distinction, is that the medical route, you would be a patient, whereas if you are sort of a holistic route, it would be a client. So they have equal ownership.
Yeah, that's a legal distinction that applies here too.
But Sally, how does that occur in your line of work? Somebody comes in, they want to get fit, they either want to lose weight or tone up.
Yep.
And they expect you to make them look a certain way. Does that even work?
Yeah, do you mean coming in with their mindset, with what they think they want, and then what they really need?
And also, like, we were saying about, being responsible for yourself. If they don't then follow that through with either, a change in diet, change in lifestyle, or maybe even some exercising at home, and they just do the work with you, they're expecting you to fix them or make them look a certain way.
Absolutely. And that's my biggest issue. Most people come in wanting to lose 5 kilos and tone up. But what they really need is usually something a lot more than that. And it gets down into the more holistic approach there. So it's, it is the diet and it's the lifestyle, but it's their mindset. And it's about, it's really deep level stuff. So superficially for them, it's just like, you just go and everything will be done for you. Like you'll get to the end result because that's what we pay you for. But it's not that at all, because you have to, like with everything in life, you have to own your own journey. You have to own your own choices and own your own actions. And so, peeling off those layers once we get them through the door, and then really getting them to get more in touch with themselves and their own lifestyle, and then looking at their diet and looking at their exercise and their habits and all that sort of stuff. So, they're all clients that come in, and then, we put down their goals, but then we strip it all right back and really look at everything, as I said, from a holistic approach.
Yeah, and I'm assuming that you're not just a trainer. And I don't mean that in a derogatory term as just. But you're with them for quite a long period of time, and you're with them through this journey. So I'm sure you become lots of other things within the time that they're with you.
Yeah, and, a coach and a mentor and all that sort of stuff. But it's also like anything, if you're seeing someone 2 or 3 times a week, you become, not a counsellor, but, download a lot of what's going on in your life, which also affects your body, of course. So, you're supporting someone along their journey and helping them through it, because, as we all know, if you're really stressed and not getting any sleep, having these changes happen is going to take a lot longer and has a lot more effect on your process. So, you're going through everybody's journey, and like today I've just had 2 cancellations, one with a, medical issue and another one with hormonal stuff. And, you going through the journey with the ups and downs of whatever comes at you. You can't help it if you need a root canal. It just happens, and, it throws you off balance. And this particular guy hadn't slept all weekend and was a total mess, and there's no point pushing the body or going back into your normal routine and structure when you're out of whack.
Yeah. How does that work in your practice, Harry? So, having parents and children take responsibility for.
Well, it's important because I treat my little clients like they're adults. I give them choices. I ask permission, and that allows me to engage them when often they don't want to be with me. They're often not old enough to make big life choices because there's too many dangers out there, so parents still have a role to protect them. But I find it's massively important if I ask them what they want to do, what are their aims, what are their goals, what are their dreams, and then I'll fit in my solutions to support those goals, and that then motivates them. But they're the same as adults. They're little adults. That's what I treat them as, yeah.
And then by asking them those questions, you're also giving them the power to make their own decisions and to stick to their, or be committed to whatever the answer is, right?
Yeah, so
great training for an adult.
Yeah, if there's some activities I want them to do, I'll always give them a choice of 2 or 3. Then they are the result, yeah. If they're teenagers, I make it very clear up front that there's no point in them starting. I make it very clear to the mother and the teenager, there's absolutely no point in starting anything unless they want to do it. There's not going to be any bullying from the parent or pressure at all.
Yeah.
Save your money, save the stress. It's not going to work.
Because I'm guessing it's a long process, or a fairly long process.
It's a long road. Clients come to me for 30 sessions minimum. Yeah.
And how long, is it every week, every other week?
2 or 3 times a week.
2 times, okay.
Yeah,
So
it's about
that's a big commitment.
about 3 months. Yeah,
Yeah.
and I expect to see them if they say yes.
Yeah.
And that's what, you know, Shauna and I go through in our practices, that, you know, it's conveying to women who are very, very busy that this is not an instant fix. It's going to take minimum 3 months to even start to see something change happen. And a lot of people, I'm sure Shauna will elaborate on this, but a lot of people want instant fix. And, you know, they'll take a supplement or they'll change their diet, and within a month, they're like, well, it didn't work, so I stopped taking it. And it's like, you didn't give it a chance. If you're committed, you're committed.
So in the case of children, you can get very much faster results than that. And you see this, I see the scales falling from the eyes of mums. Sometimes the child is the little mum, you know, and they think, oh, right, that's why this is happening. Well, maybe change.
What happens in your clinic, Shauna? Do you find that? Like, do you find a lot of people who don't want to, but don't necessarily want to go down this for the long haul, that they want things to change pretty much instantly and then get frustrated when it doesn't?
I think that's human nature, especially if you're putting in effort. So I think it is very normal to, when you're putting in a lot of effort and trying to make a change, to be frustrated when you don't get the results that you're hoping for right away.
Oh, Sally has a guest.
It is.
I guessed.
Sorry.
That's okay.
Probably be me next.
Look,
Yeah. But, you know, right from the outset on my intake forms, I have a question that says, how committed are you to this? And I just like to put it out there right in the beginning about level of commitment, so that I understand where they're at in terms of, you know, the sort of cross flow of energy. And, you know, and also talking about what are their obstacles. So what are they going to blame when things aren't working? Because it's, again, good to have that conversation fairly early on, going, okay, well, it's a financial issue, or it's a time issue, or I've got so much stress in my life right now, I don't know if I can put my own needs first. And to address those quite early on, so that we're both on the same page with expectations. But it is a slower road, like, you know, learning how to take care of your body, you know, for yourself, and using a team of people as resources takes a lot longer than it does to take a pill for a symptom. And, you know, as a naturopath, I don't really have any treatments like that. And I make sure that people understand, which I'm really grateful. I work in a sort of, you know, a neighborhood and a demographic where it is, you know, maybe younger people who question, you know, the norm of medicine, and ask, you know, come in with a lot of questions and their own research. And I really, really love that and encourage it. And they're not used to that. People are not used to getting that from their healthcare providers, of like an open discussion and valuing their own research. And, you know, that's something that I, you know, again, very clear early on in our sessions.
And that comes back to, once again, owning your own health and being responsible for your own body, and getting in that mindset that it's your own responsibility for your own body, and not relying on others for band-aids, if you like, just to fix you. I mean, and I think the majority of the population still has particularly in the older population, goes to the doctor looking for the cure or looking for the fix, and going and looking for a label for what they've got, rather than just going along with symptoms and then dealing, looking at the cause, you know, which is what you do. So, you know, being responsible for your own body, owning everything and understanding your own body is really important. And I think that's the way we're all trying to shift our clients or patients or whatever you call them.
And I mean, one of the things that I say to clients, if they're kind of on the edge, wavering, I'll say, if you want a Panadol, on the wrong place, go somewhere else. Not interested.
Yeah. And I find that, and I within our realm, within, you know, the holistic nutrition realm, we're exactly the same as Shauna. You know, we do ask our clients on a scale of 1 to 10, how committed are you towards your health? And I think that tells you a lot about whether they are the right type of client for you, or whether there's somebody that you can refer, not leave, but refer out to somebody they would be better suited to. Because I think the people who, rate sort of 7 or 8 or above, those are the people who are going to utilize whatever they have, be it their medical doctor, be it their naturopath, be it their nutritionist, to really take control of their own health, have a say in it, get the testing that they need done, be able to look at it objectively and say, okay, I think I need this, that, and the other, and actually be committed to being responsible for themselves and for their own body. I think that's a big key to health and wellness, is being committed and honoring the body that you're in, and being committed to that.
So Shauna, have you actually turned away clients because they weren't committed towards their own health? If that's your sort of, I just lost you for a second.
I think she's back.
Yeah, did you hear that, Shauna?
No, I totally missed it. Sorry.
Oh, no, it froze up. I just said, have you ever had to turn away clients because they weren't committed towards their own health or working towards their own health?
Not directly. No, I mean, usually it's we reach a pretty clear point where they decide that it's not the right fit. So I've only had to out refer a couple of people, and that wasn't really about their commitment. It was more around their expectations, or that they wanted help in an area that wasn't my expertise. But generally, no, it's more information for me. And, in terms of how I approach their treatment plan, based on level of commitment. And it also, just putting that question right out front, probably some people start filling out my intake form and then don't follow up with the appointment. Maybe that just gives them the information about how this relationship is going to be right off the bat. Yeah. Yeah. But I mean, I think advocating for, your own health, that extends into all spheres. Right now, I'm, advocating strongly for my child's education. Just that sort of general taking an empowered role in your decision making regarding, your health, your family, your children, what you put in your body, your food, all of that is it's an empowered place to be. And extending that through to healthcare is something that, that we're sort of, I see in my work, but it extends in all areas of my life right now as well.
Yeah, one of the things that we actually didn't bring up in our podcast this morning, but just came up, was to be your own health advocate can also mean interviewing your nutritionist, naturopath, MD, to see whether you are a good fit, and to see, because you don't have to take the first one that comes up. And call a bunch of people, have a bunch of 15-minute interviews to see if you actually gel. I think that's a really great starting point as your own health advocate, because you're taking it, you're taking your health seriously. You want to work with somebody that you can work with. It's probably the same with a personal trainer. Yeah, get recommendations, that kind of thing. Yeah, because not everyone is the right fit for everyone.
No, you've got to connect with them and feel that energy that works with you. Absolutely. I mean, imagine if they had that with doctors, just getting back to Shauna's thing about turning people away. I mean, I don't think many doctors would turn clients away, like patients, coming in. If they're coming in for a Panadol or, strong medication or whatever, it's quite different. But imagine a world, though, where you've got all holistic practitioners and, you're interviewing them to see the right fit, and we're in reverse. We're interviewing them. Wouldn't that be just awesome? But, then that comes back to law of attraction, and the clients that you attract in are generally the ones, you've got a certain type. Yeah, so that works quite well, I think.
People interview me all the time. I have 15-minute free phone consults with people to see if it's a good fit. And I don't mind that. I mean, if it's a direct referral, usually they don't bother. But if it's somebody who's just researched me online, I have no problem with that, because it's really important.
Yeah. Especially if they don't know you, they've never heard of you before. They want to make sure that, you're the right fit. What about with you, Harry? How do you, how are you with your clients, or how are your clients with you sort of in the initial stages? Are they referred to you, or they find you and then they...
It's usually word of mouth or internet research or direct referrals. So they've often got a very good idea of what I offer and what my attitude is. It's quite clear on the website. And they check me out. They're highly internet literate. And they've all got smartphones these days.
Excellent. Okay, well, we're going to wrap it up for today. So maybe we can do a bit of a round table and just give one suggestion, one tip that you would give to your clients to be their best health advocate. So let's start with Harry.
Be a warrior for your own health.
I like that. How about you, Shauna?
My suggestion would be to think about the relationship with your healthcare provider as a consultant, as somebody that you consult for information.
Yeah. And Sally?
I'd say just, have a little look in the mirror, have a look at who you are, and start owning some stuff about yourself.
Yeah, and I think mine would be, once you start down that path, is keep records of everything. Everything, and have your own copies, because I think that's really important. And take them with you wherever you go when you go and see a health professional. It would really help, I think. Okay, guys, so if you like this episode, make sure you like us on YouTube, make sure you like it on Facebook and share it. That would be wonderful. Subscribe to our channel too, so that you can see more from the Holistic Health Hub. We will see you again next week.
Groovy.
Bye.